think good leadership affects patient services through clear communication, a clear vision and a lack of ambiguity. I think it's really important to stress those factors so that patients know where they are and they feel confident in who is looking after them.
The main difference that I would think it would make to patients, it just gives them that feeling of security, that somebody that's actually acting on their behalf knows what they're doing and will follow something right the way through to the end.
For me, good leadership for the patient is all about, from the very lowest level member of staff right the way through to the senior team. If everybody demonstrates good leadership, then there's better patient outcomes and better patient care.
I believe good leadership affects the patients because my team understand what the shared vision is that good leadership gives to people.
I feel good leadership is very important, especially in this ever-changing current environment of the NHS. Because if you have good vision, you can identify the needs of your patients and you can develop your service accordingly to ensure that you still continue to deliver the same high quality of service and can get the maximum patient satisfaction.
I think that good leadership means you can help staff work with less role ambiguity, that they know what they're doing, they have some clarity and direction, and that I think affects the patient journey because staff feel clear in their role, less stressed, less anxious, and so ultimately deliver good patient care based on some of those principles.
I think that we have patients at the centre of everything that we do, and we all strive to make sure that we provide safe, efficient and effective care that's evidence-based, and leadership kind of embodies all of that, so it empowers our staff to do the best that they can every single interaction that they have with patients, with their families and carers and with their colleagues. So without leadership we don't maximise that opportunity that our staff have to make the patient experience the best that it can be.
Good leadership within the NHS affects patients because one of the key things about leadership is enabling the staff who are close to the patients to do the best job they can. It's about enabling those people to meet their patients' needs, and therefore the best way to do that is to allow them to get involved in some of the work that I do, which is improving the system, giving them the time, space and opportunity to improve patient care as well as deliver it.
The leadership starts with the patient in what their needs are, and we train ourselves to make sure it's teamwork that provides a service for the patient themselves.
I've been very fortunate to always have very good leaders since working in the NHS, and they've shown me that actually by them inspiring me, it's inspired me to do more.
Leadership's really important because everything that we do affects people's life every day out there. So if we aren't addressing the right things, then we're not going to improve the health and well-being for the local population.
If you actually believe in the things that you are doing, leadership comes more naturally because you're not actually having to do anything different to what you firmly believe in. So it's a great opportunity to align all your thoughts and feelings and emotions and what you believe in all together, and it actually becomes sort of a very fulfilling experience.